Marshall Island, you're where we came from, the one who made us into the people that we are.
Yahweh and welcome to Ozarks ri-Ṃajeļs, a special KUAF public radio listening lab multimedia series about Marshall Islanders who've navigated new lives in Northwest Arkansas. I'm your host, Marcina Langarin, Operations Coordinator for the nonprofit Marshallese Educational Initiative headquartered in Springdale. Our guest today is Marshallese physician Dr. Sheldon Riklon, who divides his time between the Family Medicine Residency Program at the University of Arkansas for Medical Sciences Institute for Community Health Innovation and treating patients at the Community Clinic in Springdale. Previously, he was on faculty in the Family Medicine Residency Program at John A. Burns School of Medicine at the University of Hawaii. He is the inaugural holder of the Peter O. Kohler MD Endowed Chair in Health Disparities at the University of Arkansas for Medical Sciences in Fayetteville and the 2021 recipient of the Dr. Edith Irby Jones Excellence in Diversity and Inclusion Lifetime Achievement Award. Dr. Riklon is one of only two Marshallese physicians practicing in the U.S. Good afternoon, Dr. Riklon. How are you?
Good afternoon, Marcina. I'm doing well. ¿Cómo dada?
Yeah, thank you so much for being here. You and I have, I've viewed you on different sessions, and so I'm so glad for you to be here with us today. Let's begin with where were you born and what year? And if you can describe your childhood back home, what was it like?
Absolutely. I was born on Ibai Island on the atoll of Kwajalein. And I was born in 1967, which kind of dates me at this point. But if I had to describe my childhood, I would say fun. I mean, I really had fun growing up and playing with friends, running around those streets. It was freedom because it was a very small island. Everybody knew each other. We loved to go and play on the sand, go in the beach, go play on the road and all different things. But it was just kind of fun time.
Yeah, I mean that's pretty exciting. I mean, growing up on the islands, I'm pretty sure that's what life was like. Cause I grew up in Hawaii, so I kind of relate. But I honestly wish I had grown up in the Marshall Islands because growing up in the States, it's life here is definitely different than back at home in the islands. And just a quick side question, what actually inspired you to become a physician?
That's a great question. Growing up, I did well in school, even in grade school. So my teachers, my friends always want me to go and pursue something higher. They're always talking to me about either being a lawyer or a doctor or something else. And my parents were actually in the health field as well. My dad was a medical officer, and my mom was a registered nurse at the hospital. So just growing around that healthcare field and seeing what they do kind of inspired me to be kind of what they were doing. They seemed to be enjoying it, and I saw that they were changing lives, and I figured maybe that might be something for me as well. So that started igniting the fire on that.
Yeah, I know. For someone who is in the youth category, or a lot of the young adults in our community, from what I've heard, they really do look up to you. If you
Thank you.
didn't know that, they really that you're such an icon, is what they've told me. And I know a lot of young girls actually, they would like come up to me and be like, "Oh, I want to be like Dr. Sheldon. He's such an inspiration, and I hope one day that I too can join him in being a Marshallese
I
physician
hope so
in the
too.
U.S."
That'll be
And
great.
so, yeah, let's get into the next question. So, what endemic chronic diseases were pervasive among islanders, and the root causes of this? And can you summarize access to healthcare in the Marshall Islands?
Sure, absolutely. Growing up in the 1960s, 70s, I think it was mainly the infectious diseases that were,
Mm-hmm.
more pervasive at that time, and they were quite endemic ones as well. The endemic being the more pervasive diseases in the Marshall Islands at that time were more tuberculosis, TB.
Mm-hmm.
Hansen's disease was one of them as well. I think even at that time, polio was, something that we're all worried about as well, and large number of cases. And some of the STIs, sexually transmitted diseases as well, like, syphilis as well. You know, mostly when you talk about endemic diseases, it's diseases that are quite prevalent at that region of the
Mm-hmm.
world. And even though diabetes is, and global disease, just the number of cases that we have in the islands, I cannot tend to label that as endemic as well, because
Mm-hmm.
that's something that we continue to be challenged with in trying to address the needs of our patients in our community, in addressing their needs when it comes to that aspect. Access to care in the islands at that point, including now, it's still mainly through the hospitals, right? That's one of the things that's very different from the Marshall Islands to the States. If you're sick or you need to see a physician, you go to the hospital to seek care. There was really no private clinics until recently. There's just one. But otherwise, you go to the emergency room, you go to an outpatient clinic. If you're coughing, if you have a pink eye, or if you have
Mm-hmm.
chest pains, anything and everything that is health related, you go to the hospital for your vaccinations and immunizations as well. So everything, access to care back in the islands is quite different from
Mm-hmm.
what it is in the States, because over there you really don't need insurance. You
Mm-hmm.
basically, as long as you're a resident, you can go and seek, medical care access there.
Do you feel that more people lean towards more traditional medicine rather than, going to the hospital back in the Marshall Islands? And is that the same for Marshallese here in the States?
It varies. It
Mm-hmm.
varies. Even back home in the islands, it varies. I think it's more the older generations
Mm-hmm.
that they would seek more traditional Marshallese medicine first. Okay. And sometimes it's easier because you know who you're supposed to go and seek care from. And traditional medicine, it varies, right? It can be involving just plants,
Mm-hmm.
herbs, but there is some traditional medicine that involves plants, herbs, and sayings, things that
Right.
you're talking. There's certain ones, and not everybody knows it. There's only certain people who practice it.
Mm-hmm.
So there's definitely more traditional medicine being practiced back in the islands than here in the States. And one of the reasons is because you don't have all the plants that we have
Right.
back in the islands here in the States. Because even a simple thing like for us that we grew up with, like coconut, I
Mm-hmm.
mean, I wish we had coconut trees in
Right,
Arkansas.
right, right. But yeah, that's yeah, because I've seen a lot of the older generation, they lean towards more towards traditional medicine because I think with the knowledge of knowing access to healthcare in the US, although it is very easy, it's something that, they're not really in tune with. And so I see them leaning towards more traditional medicines. And so, yeah, so the next question. So, for those who aren't aware, the Marshall Islands does have a nuclear legacy with the United States. First, in 1946 to 1958, the United States detonated 67 atmospheric nuclear and thermonuclear weapons in the Marshall Islands, at the time a UN trust territory administered by the U.S. government. What have been and continue to be consequences of those Cold War weapons experiments on the Marshallese present at the time and their descendants?
That's a even greater question. I think that part of our history is the one part that really affects us that day going forward. And I do not see an end to it at this point. I mean, if you really think about it, right? 67 thermonuclear weapon tests detonated during those 12-year period, right? It's more than 7,200 Hiroshima-sized bombs being detonated. and you're destroying lands, islands vaporize, right? And then you're also destroying places where people go and get their food from, right? It affects the oceans, it affects the trees, the soil, the water, everything that it has to do with that. And then it also, not just that, but it also affects the people themselves, health wise, physically, mentally, psychologically, but also culturally, right? Because we, as Marshallese people, as islanders, our culture is also dependent on the land. It goes through the matrilineal heritage, coming down the pipeline. But you identify yourself on that piece of land that your parents, your family is assigned to. So when you take that away, there are some people from some of those places that have been displaced because they don't have any more land anymore. There's at least a group of people like from Enowetak who are living on the Big Island because they don't have that land identified by it. And if you destroy the culture, the way you live every day from then to now is different, right? You go from a people that you're dependent on the ocean, and you go and harvest the crops, you climb the coconut trees and breadfruit trees. You're active every day, and you get fresh fruits and vegetables and meat and fish all the time. To now where most of us, we have to go to the store, and we're quite dependent on processed, unhealthy, canned foods. So health and culture and socioeconomic development, all those come into play. That it's affected us since then to now that our cases of many chronic conditions are quite high. And many of the complications that come from it stem from that time because of all those different kind of changes.
Mm-hmm. And I think what most people don't understand is like, we didn't ask for this to happen, and then to be, dependent on the ocean waters, and then on the land, to having to be dependent on processed foods all of a sudden. Like, I can't imagine, the transition to having to do that. And so let's move on to the next question. After Marshallese leaders declared independence from centuries of foreign occupation in 1979, the Republic of the Marshall Islands entered into a formal compact of free association with the U.S. in 1986. That compact allows the U.S. to maintain a remote strategic military base on the Marshall Islands, and islanders under the compact can freely travel to and live in the U.S. as legally present migrants for work, education, and much needed medical care. But medical providers here in Northwest Arkansas who first treated Marshallese reported a certain shyness and lack of complaint among islanders. So, can you explain why that is?
I think there's different reasons behind that. One of it is the language. Okay, for many of us Marshallese, if you're not comfortable speaking English, which is not your language, and usually the older folks don't know English as much as the younger generation. So you're more shy in saying exactly what you want to say because you're not comfortable speaking English, so you don't say as much as you want to. And then whoever's there next to you, whether it's a formal interpreter or your son or daughter or granddaughter or grandson, would be your interpreter when they're seeing that provider. That's one reason, but there's other reasons, and the other reason is because of the history that we just talked about, as far as the nuclear legacy history. That basically makes us quite mistrustful of others, right? Because as Marshallese, as islanders, we trust each other all the time. We're dependent on what the other person sees, it says, and does. And actually, that's our culture. We help each other whenever we need help. It's a group dynamic. It should not have. It makes us mistrust others. It makes us mistrust, especially Americans, because they're the ones we see that they did all those bad things to us. So sometimes, even though I really need to say something to a healthcare provider, I have to wait until I can build that relationship with them to understand if I can trust you to tell you my deepest, most private complaints for you to help me with it. So there's different factors, but I think those are the two main ones.
So from what I'm hearing, it's basically more healthcare providers needing the correct cultural competency and knowing our history. And so I think with those two in hand, I feel like if they were to know better about that, like helping Marshallese would be a little bit more easier, or at least they would understand more of why Marshallese are the way they are. And so medical providers also saw evidence of widespread compromised immunity. Do you care to comment on that?
Absolutely. If you really think back through the years and even during the nuclear weapons testing program, because and then you look at at Marshallese, many of the chronic conditions we have, and they're bad stuff that affect your immune system. You talk about diabetes, you talk about high blood pressure, you talk about cholesterol issues, you talk about dementia, you talk about strokes, you talk about all the different infectious diseases, and we have it. That adds to your immunity, or at least compromises your immune system. And then if you think about that nuclear legacy in affecting how does radiation, how does radioactivity affects you, we may not have the evidence yet that there's a direct correlation between that and our immune system, but it does kind of make sense if you really think about it, that the more you're being affected by radiation chronically over a time period, long time period, and you continue to be exposed to it, it kind of makes sense that your immune system is affected and there is decreased immunity that you have. And we this past pandemic really made us really worried, because we for people who work with Marshallese patients, they already know that we have all these chronic conditions that affect our immune system. We also have our rates of cancers, and we have people who are cancer drugs and all those kind of things, immune modulators because of those things. But all those things affect our immune system, and it's because of who we are.
Yeah, like the pandemic was definitely, a scary time. And, social media really did play a vital role. And I do want to thank you for, setting up those Zoom videos that you had, like, I think it was like every week. And you still do that today. And so, that really did play a vital role on, announcing what COVID looked like, the effects of it, and other factors as well. So I just wanted to thank you for that and providing that to the community. And so the next question, in the late 1990s and early 2000s, most low-income Marshallese went to local ERs for medical care, providers reported. But things have changed. Today qualified islanders can enroll in federal health insurance marketplace, apply for Medicaid coverage, and enroll their children in our kids' health insurance. Northwest Arkansas community clinics also provide much needed affordable primary care. What is the outcome of access to such entitlements?
Well, first of all, thank goodness that that changed, right? Thank goodness for the restoration of COFA Medicaid. Um, and even though there's still some people who still go to the emergency rooms and hospital, because that's how we do it back home, right? So it's more a matter of trying to educate them that you need to come to the clinics, like places like Community Clinic of Northwest Arkansas. And thank goodness to those federally healthcare qualified health centers, because they really are set up to address the needs of those who are most underprivileged, those who really need the help, not just health-wise, but also address all their social needs. And because of our restoration of the Medicaid, that we can have coverage not just for the kids, and Arkansas has always been supportive of the Marshallese here, starting with the kids, in the beginning, And then later in December 2020, where Medicaid was restored for all of us at that point, including anybody from the U.S. affiliated states, that we see more patients actually going to the clinics. I see more patients coming to the clinics that I work at. And there's like new ones pretty much every week that I see, and they come, which is great because that's what they're supposed to do. And but when they come in, most of the chronic conditions, if they haven't been seen by anybody, is quite out of control. So it's a matter of trying to kind of take control of those current conditions. But as you're seeing patients, you also have to kind of educate them. And we have other people who are also trying to educate them as far as what is the healthcare system like here? What is Medicaid? What is Obamacare? What is private insurance? What are these co-payments and what are these penalties? And I think that's where we're still kind of struggling in trying to enroll people, not just enrolling them, but keep them enrolled. Okay, because to stay on Medicaid, you still have to follow certain rules and some documentation that you need to turn in on a regular basis. So that education piece is key. So it's great that they're coming in, but you need to make sure that they stay enrolled in insurance.
Right. And, just to add on to that, a lot of pioneers in Northwest Arkansas who, spread awareness about the restoration about health insurance, that was super exciting to see. It was more inspiring to see our, community really be out there, go to DC, talk to U.S. representatives about, the Marshallese people and the importance of us. And so I really do give kudos to all the community workers, in North Marshallese community workers in Northwest Arkansas who played that vital role. And so, as more Americans are adopting healthful lifestyles, more Marshallese are adopting healthful traditional foodways and exercise. Can you cite some examples and what benefits you are seeing?
I think it's one thing for you to come from the islands to Northwest Arkansas and really not expecting that you're going to come and find Marshallese foods here. Because we do, and it's unreal because you're thinking, wait, we're in the South and we have breadfruit and we have coconut and we have all these things. We have ramen and we have, unfortunately, that's a quote unquote Marshallese food at this point. But, you can, some people are adopting, American foods, fruits and vegetables, which is great because many of them are quite, healthy and nutritious. But certain ways that we're also kind of trying to teach our community members is, you can take the same kind of foods, but you just got to prepare it differently. Make it healthier. Instead of frying it, boiling it. Okay. Instead of adding that packet of salt soup base to your ramen, make it half of that, right? Instead of eating all those 4 donuts, go half of that, okay? Instead of just eating the rice and the corned beef, add some vegetable to the corned beef, some corn or some green bean, and then, cook it healthier that way. So you don't have to really change how you eat. It's just the way you prepare it, right? Instead of frying that fish, grill it. It's delicious. It's very delicious. But even when you bake it or you broil it, it's healthier that way. And fish, you cannot go wrong with the fish. Fish is pretty much healthy whichever way, except when you fry it. And then any kind of foods that you normally eat, you just gotta prepare it healthier than what we're used to.
I think what I love about UAMS actually is, the many different type of programs you have, especially like, the portion sizes. I've seen the red plates that you guys have provided. Learning how to farm. That's another, because farming is a really big thing right now, and it's really really interesting to see Marshallese really get into farming or gardening, and so that's really exciting. It's slowly getting there, but I think that's it's progress, and it'll be really cool if it's 5 years from now, like all ri-Ṃajeļs will be farming or gardening, and so it'll be
We were traditionally farmers and fishermen, and it's just that you just got to know the season and what you can plant in Northwest Arkansas. A little bit different.
so. In closing, so what more needs to be done to accommodate the medical needs of Ozarks Marshallese, given the sacrifice our people made for U.S. national security during the Cold War extending into today?
Yeah, I mean, I think the sacrifices that we made, it's has affected the whole world. So, I think we deserve the royalty of the royal of all coverage for healthcare.
Hmm.
Unfortunately, we are not at that stage yet. Making some small steps along the way, but not there yet. And it's great that we have the restoration of Medicaid for us. We have people, especially in Arkansas. Arkansas has always been quite supportive of us, especially in Northwest Arkansas, and through the federal government, the state, everybody's been quite supportive. That even different states and even our own folks back in the islands are kind of jealous that we have all this relationship with them. But we're fortunate that we have that. I think is again continuing to make sure that we still have that literacy in terms of health insurance being explained. All those social net programs, things are opening up as of the recent signage of our compacts, especially with the disability, with the insurance part of it, and food stamps and all those kind of things, which is great. Those programs should be used for the people who need them, and most of our people need it. But as long as we can kind of fix the policies and procedures so it can go in action as of today, that'll be great so they can continue to access those services. The way I see it, as long as we're provided all the tools just like anybody else, right? As anybody else who's getting it in the U.S., as any other American is getting whatever benefits they have, we deserve the same benefits because we're here. We're American Marshallese, right? We pay our taxes. We got our history and all those kind of things. So we should be given the chance and opportunity to access those different kind of programs. When you do that, including housing and other things, including education and other things, when you do that, you're basically investing into your own community. If you invest into your own community, you make them prosper, you make them healthier, you make them want to continue to be productive members of the society. And for us as Ozark Islanders, we love the Ozark Mountains and we love Northwest Arkansas, and we would be proud members to continue to contribute. We just got to be given the same access like anybody else at the baseline.
I do have to agree with you. Northwest Arkansas, like Marshallese, we really are fortunate to, have so much access to different programs that are catered specifically to our community. And so, that's what I tell a lot of people from out of state. ri-Ṃajeļs here, we're very blessed, to have so many people who are willing to do what it takes to make sure that we are comfortable here, but also get access to set programs, even though it's not everything, it's something and it's progress. And so hopefully in the near future we do, as you said, have access to everything as an American citizen does. And so and is there anything else you wish to say to our listeners today?
Just want to thank Arkansas for all the support that it's always given us. Continue to learn. I think one of the big things as Marshallese and people who work in the community, as myself as a healthcare provider and others, we have so many great leaders, great Marshallese advocates here that are doing awesome nonprofit work in the universities, work in the healthcare fields, as community health workers and other things that, it's amazing to kind of see the breadth and distribution and that they actually can. So if there's any institution in Arkansas or any other state in the U.S. who really wants to address the needs of the Marshallese, then they need to invest in us, right? You need to invest in us by hiring us into your facility, into your institution, either as a community health worker or patient navigator or whatever you want to call us. But they can be the bridge between your institution and the people you serve, whether they're patients or clients or what have you. And they can bring them into your clinic, bring them into your institution, but they can also turn around and be the cultural liaison for you and educate the staff so they can be more culturally appropriate and adaptive.
Yeah, well, thank you so much, Dr. Sheldon. Thank you for being a legend in the community. Thank you for being an inspiration to, the young adults, the youth in our community as well. And so I've enjoyed, our interview. As I said in the beginning, you and I have been on multiple interviews, and I feel like after every interview, I learn more things about you and what you do. And so I just want to thank you for that. And thank you for being here with us today.
Como la Marcina.
Marshall Island, you are my homeland. We won't forget you and all the things that we've been through.